Good morning, everyone. Phil Penarski here with CBS 42 Now. Hope you're all having a great start to your day. In just a few short moments, we will be hearing from State Health Officer Dr. Scott Harris as he gives another COVID-19 briefing. It looks like he has already approached the podium and he will be speaking momentarily, so we will send you there live now.
Minimize the background noise. We just wanted to give you an update on the things that have happened since we were here last week. This is just an opportunity for us to let you know what the numbers are, what we're seeing, and then give you an opportunity to ask questions as well. I think you're probably aware that we've had a significant jump in hospitalizations. We talked about that last week, and that trend has continued this week. A month ago, we were right at 200 patients hospitalized in the state, actually under 200. As of yesterday, we were at 1,848 hospitalizations. 37 of those were actually children, or pediatric patients, children and adolescents. We have right now in Alabama about 7% of our ICU beds that are currently open and available, so about 93% are currently occupied. We've particularly had large numbers of patients we've seen in Mobile County, but we also have fairly high census numbers of COVID patients, at least, reported in Birmingham and Huntsville as well. So those numbers are increasing. It's being reported to us from the hospitals that virtually all those patients are unvaccinated patients. I don't have the numbers to give you on that. We don't collect that directly, but I know the hospitals themselves collect that information, and that's what they reported. We hope to actually have access to those actual numbers so that we can tell you that, but well over 95% and probably much higher than that are unvaccinated people, unfortunately. We are continuing to do vaccinations. We have fortunately seen a jump in the vaccinations that we're giving. We're over 10,000 shots per day every day this past week, or at least every business day last week. At one point, I think we got to 16,000 on Friday. That's the highest number of doses given in a single day since mid-May. About 2/3 of those doses are representing first doses. So we're very glad to see that people are coming out and doing that. Virtually every county, I think literally every county in the state has seen an increase in the rate at which they're vaccinating new people. So that's encouraging, but we still have quite a long ways to go. We passed this past week 2 million people who received at least one dose. The number from yesterday was 2,053,367 people, 2,053,367 people who received one dose at least, and then over 1.6 million of those people have completed their entire vaccine series. So that's encouraging. That's still not where we would like to be in terms of the United States. We're still at or near the bottom in most ways you would measure that. So that's concerning because it just makes Alabama susceptible. We are worried that with large numbers of unvaccinated people, we're going to continue to see the trends we've seen. Remember, if you go get vaccinated today, and we hope you will, it's going to be somewhere around 5 to 6 weeks before you can be fully protected, because your first dose today means a second dose in 3 to 4 weeks, and then a couple of more weeks after that to realize full immunity. So please go get vaccinated as soon as possible. We're not likely to see a large benefit from those vaccines today for more than a month away. So that's why time really is of the essence. Just as a reminder, the vaccines are extremely effective in preventing hospitalizations. They're extremely effective in preventing deaths. I had some information I was going to share with you on breakthrough cases. We've, as I mentioned, gotten now to beyond 1.6 million Alabamians who've been fully vaccinated. We have reports of about 6,400 who've had breakthrough infection, so about less than 0.5%. That's about 0.4%. The number we actually have is 6,427 people. Those are people who were fully vaccinated who subsequently were diagnosed as being positive. That's a very, very small number. The percentage of people who have died who have been vaccinated is, let's see, even lower than that. Let's see. we actually have 26 total deaths reported in people who were fully vaccinated. So 0.002% who were of the fully vaccinated. So please get vaccinated as quickly as possible. We have 3 safe and effective vaccines. They're free. They're widely available. We are now have vaccines available for free in more than 1,400 locations, multiple locations in every county in the state. And we would encourage you to please do that as quickly as you can. We have lots of vaccine available, as I was saying, about 1.5 million doses that are here waiting for someone to come and take them. We are starting to see some wastage. I think I first mentioned this to you last week. As of right now, we've had wastage of J&J about 7,000 doses, of Moderna about 11,000 doses, and Pfizer about 47,000 doses, and that's because a lot of Pfizer expired at the end of July, so that number has jumped quite a bit. So all in all, we've counted 65,511 doses that have gone out of date. Unfortunately, the shelf life on J&J was extended somewhat by a few weeks, and that's helped us with some of the J&J. But 65,000 doses have been wasted. That's extremely unfortunate when we have such a low vaccination rate. And of course, there's so many people in the world that still don't have access to vaccines, so that's really a shame. We are continuing to see the Delta variant in pretty high numbers, although we're still not looking for it on a really large-scale way. We've identified 558 Delta variants through genomic sequencing so far. They're coming from all parts of the state. We've only been able to sequence about 2% of our breakthrough infections, so I think we feel like it seems likely that Delta, accounts for most of those breakthroughs we see, but we just don't have enough numbers to really say that for sure. CDC is doing surveillance genomic sequencing in all states, and Alabama has finally reached a threshold for them to start reporting that. They started reporting that last week, and around between 75 and 80%, I think, of the ones they've looked at in Alabama have been the Delta variant. So that's consistent with what we're seeing around the country. Over 80% is the number you see in most parts of the country. We want to remind people that if you got your first dose and you haven't gone back yet, even if you missed your appointment, it's not too late. Please go back and get your second dose. However long it's been, if it's been at least 3 weeks for Pfizer or at least 4 weeks for Moderna, however long it's been beyond that, we want you to go back. It's not too late to do that. We know with the Delta variant, especially, the second dose makes a big difference. Your protection jumps significantly with the second dose compared with only a single dose of any of those vaccines. So please consider doing that. We still don't have information yet on booster doses. As you know, that's a hot topic right now. We know that Pfizer has been talking to FDA about the possibility of booster doses. We certainly expect Moderna is going to do that as well. At the same time, I will point out that this week, Moderna released their 6-month effectiveness data on their vaccine, and their vaccine remains highly effective with 6 months of protection at least. The very same data was released by Pfizer a week ago. So both of those vaccines are very effective at 6 months. There may be a slight small off in effectiveness, but they're still highly effective. So we anticipate booster doses will happen at some point. Not clear if they're going to suggest that we do that before the end of the year or if it'll be longer than that. We just unfortunately don't know that. I'm aware there are some countries that are doing that, but not in this country to this point. So let's see. We are following with interest a story about FDA, the potential for a full FDA approval of the Pfizer vaccine. That application has been submitted for a while. We are hearing the same stories you're hearing in the national media about that being done as quickly as they can possibly do it. I will say that, with these COVID vaccines, when they finally come to full approval, there will be more safety data on these vaccines than any vaccine that's ever been approved in history. And that's because it's been released under an EUA. It's been given to 190 million people before, and it's not even fully approved yet. So when they finally get to the point where they're able to make a decision on approval, they will have 190 million patients worth of safety data to go through. So we feel very confident they're going to have all the information that they need to make a good decision, and we anticipate it'll be fully approved, but we just don't know yet what the timeline on that's going to be. We, of course, are. One other thing I wanted to mention, we actually have had 3 straight days of double-digit numbers of deaths reported to us. A little early to say if that's going to be sustained, but I think we worry that it has been. You know, deaths are a lagging indicator in a way. We see case numbers go up first, and then usually a week or 2 later is when we see hospitalizations go up, and then usually a week or 2 after that is when we see deaths go up. Nationally, you know, with the spread of the Delta variant, it's not been clear that deaths are going to go up in the same way just because you have younger people getting infected for the most part on average, given that so many older people have vaccine protection. But we have had over the last 3 days reported to us 26 deaths reported to us from yesterday, 13 the day before, 19 the day before that, and it's been a few months since we've had 3 consecutive days with those kind of numbers. Now remember, these are the deaths that are reported to us on those days, so they didn't necessarily occur yesterday, and you can look at our dashboard and sort of see when those deaths actually occurred. It takes deaths a little bit longer to get reported to us. It's just a little bit slower mechanism, and it goes through several different things. So we kind of allow up to a month before we feel comfortable with the death data we're seeing. But certainly it's gotten our attention that there are 3 straight days of double-digit numbers there. Sort of similarly, we've actually had now 4 straight days of over 3,000 cases per day being reported to us. We had a little over 3,000 yesterday, almost 3,800 on Wednesday, 3,200 the day before that, 3,100 on Monday. So that's clearly much, much higher. It's more than 10 times higher what we were seeing at the beginning of July. I did want to mention to you who follow the dashboard closely, they're going to make a little bit of an adjustment over the weekend that shows the timing of our case numbers. Some of the total case numbers are going to stay the same. You're going to see a little bit of change in the days those were reported. I don't think most of you would notice it, but we'll put a notice up about it in case you're one of those people who closely follows the dashboard numbers. You'll see a little bit of a shift in terms of the days the cases were reported to us and when they actually occurred. Finally, I'll just wrap up by saying schools are getting back into session. Obviously, that's a very hot topic right now. We issued our toolkit. We sent it to the Department of Education last week, but it was released to the public on Monday. We've had several calls with education officials about that. We did a really good call yesterday, or maybe day before yesterday, with more than 100 superintendents around the state. We're talking to many of them all day long. You know, there's certainly the topic that everyone wants to talk about are masking in schools. We support universal masking in K through 12 schools, in keeping with what CDC has said. It's not going to be a state mandate. The state is not going to mandate that, but instead that's going to be a decision for local communities, for local school boards to make. Not every community is the same. There are different factors that have to be considered in each school board, but our view in public health is that universal masking is the best way to protect people. Not only does it prevent transmission of disease, it's also a great way to keep kids in school who've been exposed to a case so that they don't have to be quarantined. CDC allows that if kids are spaced properly and consistently masked, then they don't have to go home if they're exposed to a case, as long as they're not having symptoms. So that's another advantage to universal masking in schools. We also continue to endorse the idea that in indoor public spaces, there should be universal masking regardless of vaccination status. That has to do with the infectivity of the Delta variant. It's very highly transmissible. Even though most people who are vaccinated don't get infected with the Delta variant, if it happens, they can be very infectious themselves. That's a new phenomenon we have not seen with previous strains of the coronavirus. So previously, if there were breakthrough infections, those people rarely got sick and rarely transmitted the disease. Now it's still true that vaccinated people rarely get sick, even with the Delta variant, but if they get infected, they can transmit pretty effectively. So that's definitely a change that we had not seen before. So that's all the prepared comments I had to make, and we'll start here in the room, and then we'll get to the phone, but I'd be glad to answer your question. Okay.
Sure. Dr. Harris, you said about 95% in the hospital are unvaccinated. Can you say how you kind of arrived at that estimate since you don't have the exact numbers?
Yeah, sure. So that number came to us from the Alabama Hospital Association. They're polling their own members. I'm not sure quite what frequency, but a couple of times a week, I think 2 to 3 times a week. And those are the numbers that they report to us. I haven't seen the actual stats. I don't know, for example, what percentage of hospitals are reporting to them, but I think most of them are. And we have asked them to help find a way that we can see that data and the public can see that data as well. So they're working on a way to do that. But I would say that's been pretty consistent with what the rest of the country has seen. Because there's 190 million people vaccinated in the country, we are seeing some vaccinated people be hospitalized as well. So probably that number of 90-something% is going to drift down over time. And the reason is just because you have so many vaccinated people out there. The hospitalizations and the very few deaths we've seen in vaccinated people have been, unfortunately, in people that you would expect to be high risk. They tend to be people who are older and have chronic health problems, the people who are already at high risk. But hopefully we'll be able to show you exactly those exact numbers as soon as we see them. We haven't seen them ourselves, so yeah. Yeah.
You talked about schools, and it seems that many of the state universities are kind of following suit and sticking to the plan with the mask recommendations, but in K through 12 schools where you have some of those 12-year and under schools, what would be your message to those superintendents that are on the fence about making that decision whether to require masks in the schools? And I'm sorry, this is a two-tiered question. Are you concerned that there may be sort of an uptick in infections when schools are back in session?
Sure. Let me answer the second part first. I think we are concerned that when you have lots of people back together from different homes, in the same building every day, all day long, especially if they're not vaccinated or have the opportunity to be vaccinated, absolutely we're concerned we're going to see an uptick in infections. So I think that's clearly a concern. I think the message for schools that are still trying to decide that is that we believe that this is a recommendation that keeps kids safe, and that's why we're making it. I absolutely understand that it's a really difficult decision. There's a lot of impassioned people out there who feel really strongly about it on either side, and we are hearing all day long from people who are completely pro-mask and completely opposed to mask, and it's all day long. I would just say we're only making this recommendation because we think it's the best way to keep people safe. That's what we think. Schools are buildings that are full of kids and adults. Not everybody has an opportunity to be vaccinated. Like you said, anybody under age 12 has no choice about whether they can be vaccinated. There are kids who have chronic health problems who are in schools that may or may not be vaccinated, but are still really, really high-risk people who are just part of the normal classroom environment. We have adults who work in schools who, again, may or may not be vaccinated, but in some cases may not be able to be vaccinated. We have seen, what it's like trying to do school virtually for a year, and it was not a great experiment, in most cases. We really want to keep kids in school for face-to-face instruction for not just academic reasons, but for all the social reasons and mental health reasons and even nutritional reasons and all those good reasons. So this is our best advice to keep kids in school.
Will there be any new protocols that you are thinking about implementing or at least suggesting?
In schools, you mean?
Yes, sir.
Yeah, so the guidance we have for schools is really pretty similar to what we've had before in a way. I mean, certainly for unvaccinated people, really not much has changed. But the real difference is that understanding the importance of keeping kids in school, CDC is making this allowance of 3-foot spacing as opposed to 6-foot spacing, as long as there's consistent mask wearing. And so that's perfectly acceptable. If there is a case that happens to occur and everyone's consistently wearing masks and being at least 3 feet apart, they don't have to go home and quarantine. That's the big change, and that's certainly was a huge issue last year. Even as some of these schools tried to get back to in-person learning, we were seeing cases all the time where a whole classroom was having to be sent home and kids were out of school again and back on virtual. So the biggest change has to do with 3-foot spacing as long as they're consistent mask wearing. You see, let me go to the room here and we'll go to the phone next.
I'm just curious, with the amount of low deaths we've been seeing, is it also a matter of fact of that we're just better at dealing with the virus now and how to handle the disease?
Yeah, I think that certainly could be a real big part of it. You know, our hospitals and doctors and nurses have had a year and a half of experience, and obviously that, you know, that helps in a way. You hate they have to get that experience, but they certainly are doing a much better job of knowing how to handle these people. We do have, you know, a lot more knowledge about specific treatments, you know, about the use of antiviral drugs, about how steroids ought to be used, and particularly how they ought not to be used. There's a lot of advancement made in understanding when to ventilate these patients and when to try to put off ventilating these patients, you know, if they have respiratory failure. So I think certainly we're better at it for sure, and that's I guess the one good thing that's come out of it, I guess. Let me go to the phone there.
This is Darwin Hamilton with NBC15.
Hey.
I wanted to know if there is a point where there might be enough cases, both either in school or publicly, where a universal mask mandate, there's sort of threshold where you say, okay, this is something we're just going to have to do.
So I didn't catch the end of that.
Threshold where masks would come back in schools when we get to a certain point.
Oh, okay, yeah. So, yeah, I think if I understand, you're saying is there some threshold we would reach at which a mask would come back? Is that what you're saying?
That's correct.
Yeah. I would say we don't have a metric set. There's not a number that we have in mind about that. I think our recommendation now is that universal masking is what we need to do. You know, I'll just say, just kind of sort of as a example of how we think about this. You know, CDC has recommended universal masking for adults in public spaces if you're in a county that has a certain level of disease transmission. So, you know, that recommendation, which is not being applied to schools, but that recommendation for adults elsewhere in the world who are out in public spaces has to do with the rate of community transmission in your county. And so, you know, there's some states where that rule is not, you know, being recommended because disease transmission is low. In Alabama, I think yesterday we had 66 of 67 counties that would have met the threshold for that, and for most of the past 2 weeks it's been all 67 counties. And so that just gives you an idea that even if you're not seeing really high case numbers at first, we have really high levels of disease transmission going on in every single part of our state right now. So our recommendation for universal masking is going to stand. It's been made very clear that the state's not going to order that. You know, it's not going to be a mandate, but that's our recommendation.
Dr. Harris?
Yeah.
Within the ADPH toolkit, there's a requirement for masking on buses. Why on buses, and how can we expect school districts who don't even have mandates to enforce that? Yeah, sure. So the question has to do with masking on school buses. So that actually is not our requirement. It's not a state of Alabama requirement. This is a federal requirement from the Federal Department of Transportation. When the feds put into place their rules that apply to airports and subways and other types of public transportation, that also covers school buses. They're regulated under that same authority. So I certainly understand the reasoning behind it. Obviously, it's difficult to always enforce that, but that's actually comes from the feds and not from the state.
Dr. Harris, this is Alan up in Birmingham.
Yeah.
Breakthrough cases, how are you tracking them? Do you expect to change that because the Delta variant is spreading so much? And do you know about which vaccine is playing a factor here in breakthrough cases or not? Yeah.
Alan, we pick up breakthrough cases the way we pick up other things. We just, we understand who's been vaccinated. We have the, information on who has received a vaccine, and then we have information on, who becomes a case, and then sometimes they may be directly reported to us that way. We have asked, for example, providers to prioritize those people for sequencing, so sometimes people just call and say, we have a breakthrough case. But generally speaking, we pick those up by comparing who's been vaccinated with who our cases are. I don't have the numbers this week. I don't think by vaccine brand. I mentioned that last week. We had that a week ago, and I just don't have it with me. It's slightly more common to have a breakthrough infection with J&J than it is with the 2 mRNA vaccines. That's exactly what we would expect, because the effectiveness of J&J is just slightly less than those. The hospitalizations and deaths, however, were the same among breakthrough cases, no matter what vaccine product they got. So that's all consistent with what we know about those vaccines.
Do you believe that the numbers, like I said, are low? In one part, because the vaccines are so good, maybe some people are not even going to the hospital or their healthcare provider.
Yeah, I mean, I think I think we always wonder, if we're picking up anything among vaccinated people, because they do tend to have milder illnesses, or maybe they're more likely to be asymptomatic. It's obviously hard to know what you don't know, and if people are infected but don't know they are and never seek care, there's no way really to pick up on those cases. So, we have seen from the studies that we know about, the mRNA vaccines are 90-something% effective, 93, 94% effective. If you do the math on ours, it looks like they're 99.5% effective. They're probably really not. There probably are more breakthrough cases we don't know, but again, it's just more than likely because people aren't getting sick enough to come to attention.
And last question, no changes because of Delta variant spread. You're not going to step up looking at breakthrough cases or cast the net wider?
You cast the net wider in what way, Alan? What do you mean now?
I mean, just because the Delta variant is spreading so much, wondering about there's more breakthrough cases out there to step it up to another level, trying to find those breakthrough cases.
Yeah, I mean, I don't know what we would do, except, I'm not quite sure how you would do that. I can tell you that CDC has made a little bit of change in their quarantine and isolation guidance, that we are publishing our version of that any minute. But for people who are fully vaccinated who get exposed, who are identified as a close contact, we don't ask those people to quarantine if they've been previously vaccinated. But CDC has now recommended that even if you're vaccinated, if you're identified as a close contact, you get tested 4 or 5 days after exposure, just to see if you could be, someone who's infected but asymptomatic. So we're going to put that in place. I think that addresses the question you're asking. I think we may be more likely to pick up some people who are breakthrough cases who would not have otherwise come to attention by doing that. Yeah.
Hi, Dr.
Yeah. Let me.
Bobby Everett.
Go ahead.
ABC 3340 in Birmingham. There's a lot of talk about masks, and a lot of municipalities and schools are going back to mask mandates. But if we're talking about masks, can we talk about what kind of masks? I mean, I was reading a Washington Post article where some people were saying that maybe cloth masks are not protective enough against the Delta variant. And they're even maybe recommending going to KN95 masks. Do you have any recommendations on what would be the best at this point? Yeah,
our recommendations have not changed right now. There's no question that the high efficiency particulate, I forget what the A stands for, the HEPA mask, are certainly better at preventing transmission. They are a little bit more difficult to use in the sense that people have to be fit tested. They have to be using them consistently. You can't just buy one out of the package and put it on and expect it to work like any other mask. And also, even though we're in a lot better position than we were with regards to personal protective equipment in hospitals, those are still, what are being used in our hospitals and healthcare facilities. And so we're not routinely asking people to get those. They're typically using N95s, not KN95s, but the current recommendation still is to use cloth mask. I'd say we have, so many people who aren't even willing to use cloth mask. I don't think we would suggest people change. What we would rather do is just have people use the masks that are currently recommended. If we could get to that point, I think that would help a whole lot here in the room.
Yeah, you're always really measured in your tone when you talk about people that are unvaccinated. Are you worried that there might be some increased vaccine hesitancy because every time they turn on the TV or they look on the social media, these unvaccinated people, that they're called names, people are very stridently attacking them? Are you worried that that might harden their resolve not to get the vaccine?
Yeah, I think that's just a lesson for life we all figured out in kindergarten. I mean, you don't change people's mind by yelling at them or insulting them, right? I mean, that's not effective in anything, whether you're talking about COVID or anything else. I certainly understand there's a lot of frustration on the part of people who have done everything they can for a year and a half and have gotten vaccinated as soon as they could and desperately want to get back to normal when they see people who don't seem to be making those same decisions. That's, I understand that. But our goal is not to blame people or shame people. Our goal is just to try to give people the best information we can. I would say our overriding message continues to be, if you're just not sure if you need to be vaccinated, please talk to your own doctor. Please go talk to a person who knows you and your family, who you know personally, hopefully, that you have a relationship with, and ask them, what they think you ought to do. I think that's the best way to overcome hesitancy.
Dr. Harris?
Yeah.
I've heard from some people who don't want to get the vaccine is that they keep hearing, where everybody should wear masks again, still separate, and that the report of vaccinated people can still transmit the disease. What's your message then to say you should still get the vaccine?
Yeah, I mean, listen, that can be frustrating to people, when they hear that the guidance changes a little bit or what we know changes, and, unfortunately, that's how science works. I mean, the world changes. The virus is not the same virus we were seeing last year or really even 2 months ago. It's not the same situation, and so the guidance has to change. We're just trying to give our best advice to keep people safe and healthy. What I would say is that with all the variants we have seen so far that have been circulating in our country, the vaccines are safe for you to take, and they're effective at preventing disease. I mean, that's the message. And so probably we're going to get another variant someday, and I hope it's later rather than sooner. And I can imagine a situation where our vaccines may not be effective. I mean, that's the thing we all dread that could happen someday. So instead of us having to get to that point, let's try to stop disease transmission now. Please get vaccinated as soon as you can. Yeah.
Dr. Harris, are you concerned that this is more of a marathon, not a sprint, when you're talking about the Delta variants and possibly more variances being discovered?
Yeah, I mean, absolutely. I mean, we never thought this could be overnight. I know in last fall when we were seeing vaccines on the horizon, we did all of our, math and figured out how we could get to some version of herd immunity by July or so. Well, clearly we were mistaken. We didn't have enough vaccine to begin with. We had a lot less than we had thought we were going to receive. And then, we didn't have the uptake that we wish we had had. So I don't think anybody sees it happening really quickly. More than likely this disease will always be with us in a way, in the same way that we still have cases of measles and we still have, whooping cough, and we still have lots of other things. But we certainly hope that if people can do what they need to do, then we won't see it to this degree and we can get back to normal life.
Dr. Harris, this is Brennan Kirby from Fox 10 in Mobile. In a lot of ways, this wave is the worst we've ever seen. I know in Mobile we have more people in the hospital now than we ever have. So I'm just kind of curious as to the contrast in the approach this time versus last year in terms of, we shut businesses down, for instance. We required mask wearing, and you've been steadfast about recommending certain actions but not mandating them. And I'm just wondering if that is because those measures didn't prove effective last time, or if this is just about political realities. I'm just kind of curious as to what the thinking is on that.
Yeah, sure. I think those decisions, evolve and they touch on all the things you're talking about, but I think the most important thing is that we're just in a different situation with respect to what our options are. Our hospitals, are in a much better place with regard not just to the experience they have treating the disease, but in terms of their supply, their material, their ability to handle larger numbers of patients. Ventilator shortages are not an issue, even though staffing issues are still a concern. But then we also have a way to prevent this. We have 3 really safe and effective vaccines that can, reduce your chance of getting this disease by 95%. And so, we're certainly not going to mandate that people take them. But we have a way to get out of this, and so I do think, around the country, everybody's, really tired of this whole situation. I think the appetite for restrictions and mandates, is not the same as it was a year and a half ago, and we recognize that reality. But the most important thing is that we're just not in the same situation. We have the tools right now to put a stop to this if we can just get people to do it. We did not have that a year and a half ago.
And just one question on the breakthrough infections in hospitals. I've seen every patient, even if they're not coming in for COVID, are tested for COVID. And I'm wondering if you're seeing, people coming in for other things that are testing positive for COVID. I guess whether they've been vaccinated or not. But do you have a rough breakdown on how many people are coming to the hospital because they have COVID symptoms versus just picking it up in a secondary testing?
I'm sorry, I actually have not seen that data. I don't know if we have that, but I have not seen that. Okay, yeah.
Following up on Brendan's question, the hospitalization numbers captures both categories of patients. Do you have any sense of, are most people coming to the hospital with COVID symptoms and the picking up of the others are just incidental and rare, or do you have a sense of that?
I don't know off the top of my head. What we do capture is our syndromic surveillance data, and I just haven't reviewed that for a few weeks. We can probably answer that question to you for you with a little bit of research, so we'll get that to you.
Dr. Harris,
yeah.
On a personal level, how frustrated are you that we're here a year and a half later, that the vaccine has been out for months now, and that we're still having these press conferences, we're still having these conversations? Obviously, you run a big department, there's a lot more going on than just COVID. How does this affect you on a professional and personal level?
Well, it is really difficult to, watch people who work in public health dedicate their whole lives to this for a year and a half and still have this threat hanging over us in the same way. We have had people who are working literally every single day, long hours every day, weekends and holidays, and well into the night, and it doesn't seem like we're in a much different place in some respects. So that's pretty frustrating. It is, it's parallel to what you do when you practice medicine and you see patients. I mean, ultimately, what we try to do in any part of medicine is you try to convince people to take good advice. I mean, patients come to see you because they want to know what your advice is, and you give it to them, and sometimes they take it and sometimes they don't. That's just the nature that's just human nature. And so now it's just kind of played out on a much larger scale in terms of public health. We are really trying our best to keep people safe and healthy. That's what we're trying to do. It's really complicated, and not all of our advice is easy for people to take, and there's unintended consequences of everything we do. I recognize that, but we hope people will ultimately make good decisions. People have a choice about what they do. They have rights to do things and not do things, but there are some choices that are good choices and some choices that are bad choices, and we hope we can get them to make good choices. Yeah,
Dr.
Mike.
Harris?
Yeah, go ahead. On the phone.
This is Liz Hurley.
Hey.
AFF and Hunt.
Hey, Liz.
Great. Got a question for you. I have a two-part question. You talked about seeing 10,000 shots a day in Alabama. We have 66 or 67 counties who are now at high risk. We are humans. We're competitive in nature. What is the magic number? What is the balance you want to see on shots per day versus the massive increase in number of cases? You're talking about for the first 4 days this week, we've seen, more than 3,000. Is there a magic number you're looking at? Again, people are competitive. They want to see those numbers. Is there something you're looking at, a goal that people can reach for?
Yeah, Liz, we had numbers in mind when we felt like we had a slight surplus of vaccine and we had a lot of demand. We had numbers we were trying to reach, each day and each week back in February. I would say we've kind of not really set that as a goal just because vaccine is so widely available. The answer is we need everybody to get vaccinated as quickly as possible if they haven't done it yet. Ultimately we need to get to some version of herd immunity, and that could happen with people just getting infection, which is not the way to do it, because at least 2% of those people are going to die, and 10% of those people are going to end up in the hospital. Or we can get there through vaccination, but you know, the goal of herd immunity the goalposts keep moving when you get a different variant. When you get a more transmissible variant, the percentage you have to reach to get herd immunity is a whole lot higher than it was, you know, 3 months ago or 6 months ago with those variants we had then. So, I appreciate the spirit of your question, but I don't have a number. We just need everybody to go as quickly as possible.
Now, the follow-up with the CDC quarantine and the isolation guidelines, you say that ADPH is going to mirror and put that in a little while. Can you tell us all whether ADPH is actually still contact tracing, how that's working, and how school systems that have different policies are actually enacting that contact tracing? We've heard from people who don't know whether their child is going to be impacted, if there's a child at class, do they quarantine, do they isolate, all of that.
Yeah, specifically related to schools, we still, you know, require schools to report cases to us, and we ask them to notify close contacts. The actual contact tracing part of it, as opposed to just the case investigation part of it, the actual contact tracing part of it is something that we're doing in some situations, but not all, because it just simply doesn't make sense to do it when you have, you know, 600,000 cases. It's just not, we're not in a situation where we're trying to contain this. It's already widespread and everywhere. And so contact tracing is a tool that makes a lot more sense when you have smaller numbers and you're just trying to contain an outbreak. We are way beyond, you know, being able to do that. That said, we do have certain situations where we want to try to do that. If we have nursing homes, if we have certain school outbreaks, depending on the situation, if we have things that happen in corrections environments or other sort of closed environments, we are certainly continuing to do contact tracing. We still have the contracted vendors that we had before to help do contact tracing, but it's not, it doesn't really take doesn't play a real important role in what we're doing when we're getting to thousands of cases a day.
Thank you.
Sure. Let's see. Let me go to Mike first.
Last week at your briefing, I think there were 900 people in the hospital, and now it's double that. And you talked about how concerned you were about the fast increase. Do you see, from where we stand now, do you see that continuing to rise? You know, next week could be a double that number again, or what's your expectation on that?
Well, at the moment, the numbers have not slowed down. I think they certainly could continue to go higher. You know, the slope of that curve is really increasing at a rapid pace, and if you've seen the graph on the dashboard, you can tell it's almost vertical at this point. So yeah, I'd say we're very concerned about it. You know, as of today, I mentioned earlier, I think only about 7% of our ICU capacities are still available in the state. I don't know right now why it would slow down. Again, we're encouraged by these increased numbers of people getting vaccinated, but it's going to take a few weeks before that really helps us.
And one quick follow-up.
Yeah.
At some point, will we have hard numbers on breakthrough cases? You said right now it's a survey or information from the Hospital Association polling their members. Will there be hard numbers on that at some point?
Yeah, I hope so. So you're talking about breakthrough among hospitalized patients? Yeah, I think so. We requested that, and they're working on that. Mm-hmm. Yep. We have breakthrough cases that we know, generally speaking, but we don't always know hospitalization status. So we're trying to get that from them. Yep. Sure. Yeah, Kim.
What do you know so far about the effect of the Delta variant on children, if it's more severe? And in addition to that, are we going to be updating the dashboard on cases? I know Dr. Lander's had some pretty stern words in the guidance saying that, you know, this is contagious. We can fully expect cases in classes.
Yeah, sure. So in terms of updating the dashboard, or you mean just our case number?
The school portion.
The school portion. Yeah. I don't know for certain how that was all data that was self-reported to us by the schools themselves, and so we're still talking to them about that, but we certainly hope that we will be able to do that. In terms of the severity of illness, Dr. Landers may be on the call, and I'll defer to her in a second if she's on the call, but what we aren't positive about is whether this causes worse disease in people or not. There is some data that it does, but I don't think that there's universal agreement on that right now. What we do know, though, is that it's much more infectious. And so if you get, a larger number of infected people, a certain percentage of those, whatever that percentage is, are going to get sick, and a certain percentage of those are going to require hospitalization and so on, even among kids. I think nationally right now, the percentage of COVID people in hospitals who are pediatric is hovering around 2%. There's some number like that. We certainly are learning more and more about the long-term effects of COVID in everyone, but particularly in children. Some of these symptoms can persist for months after their acute infection goes away. There's other complications that we've all heard about. So I just say that maybe the data isn't clear yet, and we don't know for sure. And Karen, are you on the phone? Were you able to join us today? Okay, maybe not. Okay.
Dr. Harris, Alan
Yeah.
again. A follow-up on Mike Kason's talking about hospitalizations. Everybody we talked to, UAB, Dr. Williamson, fully believe we're going to blow past the 3,000 height number that we hit earlier this year in hospitalizations. Army Corps of Engineers did all the alternative sites, what can be done. Of course, some of that was hotels, like up here in Birmingham, which are now fully operational. Is that information still going to be used, or is new information going to be gathered to help hospitals prepare for what it does look like being overwhelmed in a number of weeks?
Yeah. We still have all that information that the Corps of Engineers pulled together, and that'll be very useful. I mean, clearly there's got to be some stuff updated if you actually make the move to transporting patients from one location to another. There'll be some more work that'll have to be done, but we, hopefully can. Hopefully we don't have to get to that point, but we just don't know. Hospitals have the ability within their own emergency operation plans to change some kind of beds into other beds. They can take a normal bed on the ward, on the floor, and convert that into an ICU bed, within the scope of the number of beds they're allowed to have. There's certainly waivers they can get from our hospital rules, from department hospital rules, that let them take non-clinical space and turn that into clinical space. If you want to put a ventilator in the cafeteria or in the hallway because you just don't have physical space, we certainly have means to do that as well. And then, really the last step, the final step, the one that we would always like to avoid, is actually creating a new alternate care site. When you put a tent in a parking lot, or you go to a building that's not designed to be a healthcare facility, you have to bring everything with you. You don't have your built-in pharmacy and your doctors and nurses and equipment and all the things you would normally have in a hospital, laundry and nutrition and housekeeping and everything else. So your alternative care sites are always going to be your last option, but we do have a lot of planning that's been done around that possibility, and we could do that if that were necessary. Yeah.
This week, the doctors and administrators in Birmingham hospitals and both down on the coast expressed frustration with the current rise in cases, saying this was largely avoidable if more people have gotten vaccinated. Do you share those kind of frustrations?
Well, I think it's correct to say that we wouldn't see these kind of numbers if we had more people vaccinated. Again, the case numbers are being driven by people that aren't vaccinated, which is unfortunate, and that's what is being reported to us about the hospitalizations as well. I also think that's not surprising to anybody, right? I mean, we know the vaccines help, so we're not surprised by that. It is frustrating to see our numbers going this way after all the work people have been doing for the last year and a half, and I don't just mean people in public health or people in healthcare, but after all the work a lot of ordinary Alabamians have been doing to try to do the right thing and protect themselves. It is tough to see.
Dr. Harris?
Yeah.
You talked about all the hospitalizations and hospitals being full. Do you think hospitals are going to start canceling surgeries as we saw last year? What is it going to take to get there?
Yeah, so in terms of limiting elective procedures, I know some hospitals have done that already to some degree. I think a lot of them are making, sort of game time decisions each day when they sort of see what their facility can do in a given day. I don't know of anybody that's, permanently temporarily announced that they're not going to do any whatsoever, but I think they are trying to be flexible around that. Yeah, I mean, ultimately, I think they're going to be having to make that decision, certainly in the hospitals that have the most patients. Yeah. All right. Any other questions or? All right. Well, great. Well, thank you guys for joining us this week. We appreciate it. We'll continue doing this as long as you guys would like for us to do it. Thank you very much.
And that was Alabama State Health Officer Dr. Scott Harris as he gave yet another COVID-19 briefing regarding the recent rise in cases and hospitalizations due to the virus here in the state of Alabama. Welcome back to CBS 42 Now. I'm Phil Penarski. Right to the right of me, actually, is a live picture of the Alabama Department of Public Health's COVID-19 dashboard, where you can find all the latest information from ADPH regarding the recent rise in cases, hospitalizations, and transmission rate, As you can see there, that red state of Alabama is mainly all red. 66 out of the 67 counties in the state are considered high risk for transmission of COVID-19, with just the single county being Bullock County with just a moderate risk. Earlier this week, we saw up to 4 counties in the state at moderate risk, but they have quickly transitioned to being high risk as well. I want to quickly go over some of the key points that Dr. Harris made mention of in this press conference before we send you on your way. He says that they've once again seen another significant jump in hospitalizations. Just a few weeks ago, they were under 200 hospitalizations for coronavirus. Now, their latest numbers show that they are at just over 1,800 hospitalizations. And the even more concerning part for hospitals being that 93% of all ICU beds across the state are currently being used. So only 7% of ICU beds are available across the entire state of Alabama at this time. And while they do not have official numbers, Dr. Harris says that hospitals have contacted ADPH saying that most of those cases that are in ICU beds are unvaccinated at this time. Some of the vaccination numbers that Dr. Harris released include that at least 2 million Alabamians have received at least one dose of the COVID-19 vaccine, with roughly 1.6 million being fully vaccinated. And out of that 1.6 million, 6,400 of those fully vaccinated people have had breakthrough cases of COVID. He says that that's roughly translates to less than 0.5% of people who are fully vaccinated have contracted the virus itself. And out of those 6,400 people who have had a breakthrough case, only 26 of those people have died due to the coronavirus. More vaccination numbers from ADPH. Just over 65,000 doses have gone to waste due to either expiring or just not being given out to other people. He said that that is very concerning. And the state has also seen 3 straight days of double-digit deaths due to the coronavirus. One bright spot, though, we have seen it across the country, that there has been a slight uptick in the vaccination rate across the entire country, and that includes here in Alabama. Dr. Harris saying that they have seen that over the last week across the state, they have been giving out 10,000 shots to Alabamians, with many of them being first doses, translating to more people attempting to become fully vaccinated to help fight this latest strain of COVID-19. And again, we will have an entire recap of this story and press conference if you missed any of it and would like to head on over to our website, cbs42.com, and check it out. And while you're there, you can also find out all of the latest information regarding the coronavirus pandemic. We have a tab under our news banner there over on the website. And you can also find all the information you need over on your phone. If you just simply download the CBS 42 News app, it is available for free for all Android and iOS devices. Coming up in about an hour, we will be hearing from a UAB doctor who will be going over sort of the history of previous vaccinations and how that relates to COVID-19, sort of giving a new perspective on trying to combat vaccine hesitancy. That is coming up at noon over on cbs42.com. We want to thank you all for joining us today right here on CBS 42 Now, and we hope you have a great rest of your day.